Hi, I'm Jodi Bodenhamer from Baxter Regional Medical Center, filling in today for Tobias on our BRMC's Healthy Connections. And today I have special guest and esteemed colleague, Kim Foxworthy, here with us. She is our STEMI coordinator at Baxter Regional Medical Center, and she's going to share some information with us about some upcoming programs and different topics that we have to offer for our Baxter Regional Medical Center emergency department. So welcome, Kim, and we're going to take a quick break and come back and hear some really interesting information. Hi, welcome back. I'm Jodi Bodenhamer from Baxter Regional Medical Center, and thanks for joining us today on our episode of Healthy Connections. Today's special guest is Kim Foxworthy, and I'm going to turn it over to her and let her explain to us some of our different protocols and information that she has available for us in case of an emergency. I think this is some really great information for us to have. So Kim, tell us a little bit about our STEMI program at Baxter Regional.
Oh, well, first of all, thank you for having me.
Yeah.
One thing that I usually start out telling people is exactly what a STEMI is.
Sure.
Many people don't know. So STEMI is actually, it stands for ST elevated myocardial infarction. So we're really talking about a heart attack.
Right.
A heart attack that we can diagnose based on EKG tracings.
Okay.
So, you know, I was so excited when you reached out to me in terms of diabetics. We know that cardiovascular disease is the leading cause of death in the world.
Yes.
In Arkansas, our rate of incidence and our mortality rates are higher than in any other state.
Sure.
Diabetics are particularly predisposed to having heart attacks. We actually see them die about 2 to 4 times more frequently from cardiovascular disease than a person that does not have diabetes. So it's a critical issue, something that we really need to talk to our diabetics about. So I think the push for this year in terms of the heart attack program is teaching people how to survive a heart attack.
Right.
And that's really what it's all about. So we're trying to get the message out to the public, not only how to identify when they're having a heart attack, but then more importantly, exactly what they should be doing.
Yes, and that's such a critical time frame, and you and I have been working on this throughout the year, actually this year, talking to folks and traveling around doing some different programs, which we're going to talk about a little bit later as well. But we do see such a prevalence and an incidence with that connection of diabetes and cardiovascular disease. And although I'm filling in for Tobias today, a lot of you know me as the diabetes nurse at the hospital, which is why Kim and I are together today as well, talking about these different connections. The other thing that comes to mind and what we want to watch out for as far as just the general population goes is some of the signs and symptoms. So can you tell us a little bit about maybe what to watch for, and then also what are some of the appropriate steps to take in that emergency situation?
Sure. Absolutely. Well, I think that everybody knows chest pain would be a sign of having a heart attack.
Absolutely.
But unfortunately, it's not quite as simple as that.
Right.
Chest pain can look differently in a lot of different people. I like to say, I like to call it discomfort.
Okay.
A lot of folks that come in say it's not pain, it's just a pressure, or it's a sensation, it's a burn, it's an ache, it's, you know, it's something other than pain to them.
Right.
And it may not be the worst pain they've ever had. You know, we know that heart attacks have beginnings. In up to 50% of the people, they will have some warning signs or symptoms. So something going on in, I say, the upper body.
Upper body.
It can
okay.
be in the chest. It can be in the arms, one or the other, or both. It can be up into the neck. It can be in the jaw area. Occasionally we'll have people come in with back pain.
Oh, wow.
As our patients get older, they tend to have it more in the abdominal area, especially the upper abdomen. So I usually say discomfort anywhere in the upper part of the body. You know, and that can be a lot of things. You know, just because you have that discomfort doesn't mean that you're having a heart attack.
Right.
We often see a lot of other symptoms that can make us think maybe it's cardiac. Things like shortness of breath, can't quite get your breath.
That's a good one.
Things like nausea or sometimes even vomiting.
Okay.
Some people will break out into a cold sweat. Now that's not the type of hot sweat, you know, when you're exercising, but kind of I'm pale, I have a cold sweat going on. We also see some people come in that say, you know, my heart just feels like it's going too fast or it's going too slow. So it's usually some combination of that discomfort and then something else with it.
So a basic, you know, lay person can look for either some sort of discomfort in the upper body, if you will, and then paired with something like shortness of breath, nausea, vomiting, or something of that nature, because it's kind of a twofold there where, you know, I know that people are concerned, and obviously I hear this often, well, I don't want to go to the ER if it's just heartburn. And I get that. That makes total sense to me as well. But at the same time, I also know, just from hanging out with you, that that can be such a critical time. And getting it checked out, even if you're unsure of those symptoms, is a huge benefit to the patient. Yes.
It is. We see a lot of people that don't want to come into the hospital. And, you know, it's so important to get it checked out because heart attack is what we call a time-sensitive diagnosis.
Gotcha.
We only have a certain amount of time to treat that heart attack. If we don't treat it within that window, the patient can end up with more heart damage and they can possibly die. So the odds are much greater. The longer they go without treatment, the higher the risk of death, the higher the risk of long-term consequences. You know, when someone, you know, the heart, it's a pump. It's designed to pump our blood around.
Right.
In that way, the blood carries the oxygen to the organs. If that pump fails, we only have a certain amount of time before death, before someone dies.
Right.
So, you know, we know that most of the damage within a heart attack occurs within the first couple of hours, so within the first 2 hours. I'll tell you, in this area, it is not uncommon to see people wait 3, 4, 5 hours before they come in. By that time, the damage can be done.
Right.
So we need to get people here earlier. The American Heart Association recommends that you have a window of about 90 minutes to get that patient into the cardiac catheterization lab and open that vessel up. And we can do that now. We have the technology. When someone's having a heart attack, one of the vessels that supplies the heart itself with blood is blocked. So we need to get in there and we need to open that back up so that the blood can get through and deliver the oxygen to the organs. And we only have 90 minutes according to the American Heart Association. That's not a whole lot of time, especially if someone's waiting at home.
Right.
We used to tell people if you've had maybe angina or you've had a heart attack before and you've gone home with a prescription for nitroglycerin. We used to tell people all the time, if you have chest pain, take a nitroglycerin, wait 5 minutes. If it doesn't go away, take another pill, wait 5 minutes. If it still doesn't go away, take a third pill, wait another 5 minutes, and then come in. Now, realizing that damage is going on and on and on every minute we wait, now we're telling people, take one pill. One pill, and if it does not resolve your symptoms, or if they go away and come back, you need to come in right away.
And call. Right.
Yes, and that's also very important. The Arkansas Department of Health and the American Heart Association have teamed up. We are working very closely with them, and they have a public awareness campaign that's launching this year. And you know, basically their tagline is, if you want to survive, don't drive, meaning do not drive yourself to the hospital. And we do, unfortunately, see people that drive into Baxter every day having heart attacks, and some of them make it to our doors, and some of them don't.
Unfortunately, it can be a matter between that phone call and a pickup, and what I find so interesting about our emergency department is that when the phone call comes and the ambulance is dispatched, then as soon as the patient is seen by our emergency personnel, whether it be an EMT or a paramedic, that information is then starting to be sent back to the ER. Is that correct?
It is absolutely correct.
Okay.
So the reason we tell you to call 911, don't drive, don't have your husband or your wife or your neighbor drive you, is because the paramedics have the technology and the equipment in the ambulance to start the treatment for the heart attack.
Right. And I don't think people are aware that that's what's going on.
Right.
As you know, as our folks are getting hooked up, so to speak, or monitored right there in their own home.
Absolutely. We put the monitoring equipment on them so that we can get that picture of what the heart's doing on an electrical basis, and we can take a look at that. And the first thing the paramedics can do is say, looks like there's a heart attack there. I'm seeing the changes that would indicate that this is a heart attack.
Right.
The second thing they can do is start the medications that we need to get on board very quickly before a heart attack. The third thing, and maybe the most important thing, is that if the worst case scenario happens, if that patient's heart stops beating, and that does happen,
Sure.
they have the equipment and the medication right there to treat it.
Right.
And there is a chance that they can give that patient the proper medication, they can perform CPR, they can defibrillate the patient, and they can give them the hope of survival. Right. If that happens when someone's in the car and their wife or their neighbor is driving, or they're driving, there's no way they're going to get to the door in time. When somebody goes into cardiac arrest, we only have a few minutes where you can go without any treatment before there's long-term damage,
Right.
and we just can't bring them back. So we need to start that life-saving treatment right away. The paramedics can do that, and that gives them, a chance. It gives them a chance to survive. And then, yes, they have the technology to send us the tracings back at the hospital.
That's what I think is so
Yes.
amazing, because that just sets up the entire team, if you will, the cardiac team,
That
to
is
get
correct.
ready and to make those arrangements, if you will. And that's what you are doing for us at our hospital,
Absolutely.
is continuing to improve that care. And we've had such great resources here at Baxter for so many years now, with our cardiologists and our cardiovascular surgeons. And then just having all of the pieces of that puzzle together now is what really makes us we're ranked top in the nation for our cardiac team, and that's in large part thanks to our coordinator here. We're going to take a quick break. When we come back, I want to hear more about some of these different initiatives and things that our hospital's doing to work for our cardiac patients, and then you and I are going to discuss an upcoming program that we have going on together. So we're going to take a quick break, and we'll be right back. Hello, welcome back to BRMC's Healthy Connections, and today's special guest is Kim Foxworthy. She's our STEMI coordinator for our emergency department at Baxter Regional Medical Center. And today we've been talking about the connection between diabetes and cardiovascular disease and heart attack, and Kim was sharing with us some of the critical pieces of information to know about when you're having a heart attack, and what to do with the symptoms, and how to get yourself treatment, which I think is something that is an ongoing. Gosh, it just seems like every year we get updates, and the American Heart Association
Absolutely.
is constantly pairing and partnering with us. And you had mentioned something earlier before the break about Arkansas and our increased prevalence for mortality rates with heart attack associated deaths. So,
Absolutely.
Tell us a little bit more about that and the connection there. You and I have talked briefly about that connection with diabetes as well, and so I think it's really an interesting piece of information for my diabetes patients to hear from you as well.
Absolutely. Well, we do know that diabetics are 2 to 4 times more likely to die from cardiovascular disease
Right.
than someone without diabetes. And in part, that's because they tend to share a lot of the same risk factors.
Sure.
So,
Right.
we see diabetics very frequently who have an abnormal atherosclerosis, or they tend to build up fat in the walls of the arteries. And I think, that is a major risk factor for heart disease, and
Sure.
it's a complication of diabetes. So that's kind of a natural progression.
Right.
That also contributes to the amount of hypertension or high blood pressure that we see
Yes.
with
Yes.
diabetics. So there again, we have another major risk factor for cardiovascular disease. So there's really a lot of tie-ins. I think that Arkansas in general has struggled for a number of reasons, in part because of our rural nature.
Sure.
If you go to some of the more urban areas, you will have hospitals every 10 miles, every 15 miles. no one is that far from a hospital.
Right.
If you can get yourself to the hospital early enough and treatment can be had, you know, the outcomes are good.
Right.
The risk of mortality decreases. But if you're a long distance, if there's one hospital that can treat heart attacks every 60 miles, that's when you run into some issues.
Right.
And I think that Arkansas has a lot of pockets like that. We are certainly in one. You know, our next closest facility, I believe, is actually right around 56 miles, and that would be in Missouri, West Plains. I'm not sure, I don't think they have 24-hour coverage there to treat heart attacks, but then also Batesville,
Right.
about 60 miles away.
Sure.
They can also treat heart attacks. So it becomes very, very important that anyone that's taking care of a heart attack patient knows where they should be taking that patient, what treatment, what medications they should be giving in advance. So one thing that the state of Arkansas is doing is trying to kind of unite all the healthcare providers. If you're in your home and you have a heart attack and you pick up the phone and you call 911, the first person to arrive to your house is probably going to be the paramedics.
Right.
Now, depending on where you live, they may take you to a hospital that does not have a program to treat heart attacks. So that hospital, you're going to encounter a whole new set of healthcare workers, and they're going to need to transfer you somewhere that can treat your heart attack. So maybe they will call a helicopter, air medical, to come pick you up and fly you over to the next closest hospital. So when the helicopter team gets there, that's going to be a whole nother group of individuals caring for you with their own protocols, their own agenda. They know what they need to do
Right.
to accomplish what they need to accomplish. And then you'll finally get to the hospital for treatment. And there you might meet people in the emergency department, you might meet people in the cath lab. They're each going to be operating off their own protocols. What the state of Arkansas wants to do is pull everybody together into one system for heart attack care. We all should be working off the same protocols.
That would make sense because
Yes.
that way when the phone call comes in, regardless of what part of the state you're in,
Absolutely.
if you are here in Mountain Home,
Right.
in the city limits, or if you're in, you know, the furthest part in Marion County from the hospital itself. And I know
Yes.
we treat so many patients in such a large service area here, about 14 counties here at Baxter Regional is our general, you know, population. And some of those counties, gosh, that's a long ways to travel.
Yeah, and it's really all about coordination of care. So, you
There
know,
we go.
we have to have plans in place before the event occurs. We need to know that if you live in a particular area, based on where you live, instead of the ambulance taking you to the closest hospital, maybe they divert and take you a different direction.
Go ahead and bring
Exactly.
you on to the larger hospital.
Exactly.
Sure.
Or maybe that distance is too far. So maybe they know if this person lives in a particular area, they rendezvous with air medical at a remote landing zone to take you to a hospital. So really that's what we're trying to do. We're trying to put these coordinated care plans in place so that we're all working together as a system instead of all kind of doing things independently. That way we all have the same goals in mind. We're performing the same interventions. We're looking at the same outcomes.
Well, and it would seem to me that would just increase and improve mortality rates for one, and making sure that our patients are getting the quickest and most direct care.
Right.
And not that we don't often rely on our outerlying community medical centers. You know, certainly we utilize those in a lot of different ways as well. But like you said, is it appropriate for them or for a patient to go there first or to go to Baxter? And honestly, that's something that I wouldn't know the answer to. You know, so that's a great initiative.
Yeah, and sometimes it is appropriate for
Right.
them to go to the closest facility.
Right.
So there will be times, you know, when that's the correct answer. But we need to put those protocols in place so that everybody's on board.
Everybody's doing the same things.
We have actually reached out and we are working with all of the surrounding hospitals, both those that provide cardiac care and those that don't, as well as the EMS agencies and the air medical transport crews.
And there's such a, you know, it gets bigger and bigger every year. There's such a diverse need for all of these different in-home cares. And, you know, you and I work at the hospital. I mean, we're used to working at the hospital. But I know oftentimes my folks in the diabetes realm of things, you know, they need help right at home, or they need help at the grocery store, or wherever they are in that point of care. And so that just makes so much sense for us to be continuing to reach out and to make that a more streamlined process for everybody involved. So I like that. And I also like the fact that, you know, we are able to do some outreach. And that's the other thing I wanted to talk about today is our World Diabetes Day program, which a lot of you I have talked about in years past. I think this is like our 16th annual program maybe, where we get together and get some resources together. We're working on diabetes updates this year. Of course, we always share those with our patients as the new protocols and the new recommendations come out. And we're really looking a lot now at our diabetes patients and making sure that they're treated for any coexisting cardiovascular issues. For example, you mentioned blood pressure, and you mentioned the buildup of plaque, which we know is cholesterol. And so we look at those protocols as well. And I know our physicians here in Mountain Home, I'm seeing it more and more often now, are looking at all of those different areas for their health. And so this year's theme for World Diabetes Day, I have just, you know, really loved and enjoyed working with you this year on these outreach programs. And diabetes and your heart has been our theme. And so we're just going to continue that because it is so important. Such a huge connection there, and also so much to continue to learn. And that's something else I think we're improving on. We're seeing better treatments for each year, not only with diabetes, but also in conjunction with cardiovascular risk, like you mentioned before. It's sort of a progressive nature of the beast. You know, you get diagnosed with diabetes, and then all of a sudden, well, gosh, now you've got high blood pressure, and now we're worried about your cholesterol. And that can become kind of overwhelming to our folks, I think. So I am really excited this year about our Diabetes in Your Heart World Diabetes Day program. We have some exciting guest speakers lined up. Kim is going to come and talk with us a little bit more about not only the STEMI program and give us some more information about that, but we're also going to be going over some CPR recommendations, which I'm so excited about. I love to learn updates on CPR. It's a scary thing, even for us healthcare professionals, to be in the moment of someone needing, you know, life-saving rescue. And so I'm really excited about that. We have some other special guests coming to speak with us about some different connections with diabetes and our heart health. And of course, we'll have Miss Jan there doing some cooking demonstrations. You know, we were talking about our cooking show during the break, and just a whole gamut of different topics there to discuss. We typically have a vendor fair where we have some diabetes vendors, and then also toward the end of the day we'll be having a special presentation for our type 1 patients as well. So we'll start out about 10 in the morning and go through the entire day there at the Lagerborg Dining Room at the hospital at Baxter Regional. And this is an absolutely free program that's open to the public. And if anybody would like to make reservations, we are taking them now. Our phone number at the Reppell Diabetes Center is 508-1765. And again, that's for our World Diabetes Day program on November the 14th here at Baxter Regional Medical Center. Kim, I want to thank you so much. I look forward to our program coming up. We hope that you can join us for that on November the 14th. And I'm just glad to have you, and glad that you are out there taking care of us, and you have a heart for us in the community.
Clever.
Yes, I love it. Thanks again, Kim Foxworthy, our STEMI coordinator, and thank you. Have a great day.